Hello, my name is Darryl. I'm going to be your host today for Jeopardy, and I have Jay here today competing for an A in pharmacology. We're going to be asking some questions on diabetic medications. All right, first we have the question for the drug insulin lispro, commonly referred to as Humalog. Please define the mechanism of action, therapeutic usages, important patient education, and key side effects.
What is insulin lispro? The method of action for insulin lispro is a rapid-acting insulin. It onsets in about 10 to 15 minutes and usually peaks at about an hour. It usually lasts in the bloodstream between 3 to 6 hours. Insulin acts like a hormone that stimulates cellular transport or uptake of glucose and inhibits hepatic glucose production. It is also involved in regulation of protein metabolism by increasing protein synthesis and inhibiting proteolysis in muscle tissue. It's used in all type 1 diabetic cases and in about 40% of type 2 diabetic cases. It can also be used to treat hyperkalemia and aid in diagnosing growth hormone deficiency. Some common side effects are hyperglycemia or low blood sugar, nausea, palpitations, and cramps. Pertinent information that the patient needs to know is the symptoms of hypoglycemia, which are fatigue, excess hunger, and sweating, knowledge on routes of administration, which is mainly through subcutaneous injections, and they must be taken with or at meals, and it also must be used in conjunction with a long-acting insulin product.
Okay, that is correct. Okay, for the next question we have, for the drug insulin glargine, commonly referred to as Lantus, please define the mechanism of action, therapeutic usages, important patient education, and key side effects.
What is insulin glargine? Insulin glargine is very similar to Lispro, except that it is a long-acting insulin. It onsets at about an hour and it has no peak, and it lasts in the bloodstream for about 24 hours. It stimulates the same thing, cellular transport, and inhibits the hepatic glucose production. It's also used in all type 1 diabetic cases and about 40% of type 2 diabetic cases. Some common side effects are the hypoglycemia, nausea, and cramps. And things the patient needs to know is the symptoms of hypoglycemia, routes of administration, and that this one is used once a day in the morning, afternoon, and night, but we must administer it at the same time every day.
Okay, that is correct. All right, and finally, last question. For the drug glipizide, commonly referred to as glucotrol, please define the mechanism of action, therapeutic usages, important patient education, and key side effects.
What is glipizide? It belongs to the class sulfonylureas, and it acts primarily by stimulating the release of insulin from pancreatic islet cells. It's used only in type 2 diabetes and is non-effective in type 1 diabetes. Some side effects are nausea, cramps, and hypoglycemia. Stuff that the patient needs to be aware of is its hypoglycemic symptoms, which again is fatigue, excessive hunger, and sweating. You cannot use this if pregnant, and you have to take it 30 minutes before breakfast every day. Also, you cannot consume alcohol while on this drug.
Okay, that is correct. All right, that concludes our game of Jeopardy, and I think Jay deserves an A.